Hello there. My name's Bryony. Please take a seat, make yourself comfortable. So I've got here that I just need to run a full set of observations on you. Okay? So I will need you just to remain where you are. Just sit and just try and calm yourself just for a couple of minutes before we begin. Okay? So to run a full set of observations, I do need to check your temperature, okay, your heart rate, your respiratory rate, your oxygen saturation levels, your blood pressure, okay, and I will just check your breathing, just as an extra precaution, and I also just want to have a look at your pupil dilation. Now those two are not usually included in our patient ops, but I would like to check them on you, okay? Is that alright? Perfect. Okay. Well, I do have a observation chart here for you, okay? And I just need to pop your details on here. So while you just stay relaxed, we'll fill in this part. So just to let you know, this is for the NHS and it's the new score, the early warnings score. Okay, so I just need to take your full name. Okay, and your date of birth. And today's date is the... Okay. Alright, that is pretty much everything. So this is the chart that I will be popping on your results, okay? And then at the end we get a score. So the lower the score, the healthier it is, or the less concerned we are, and the higher the score, the more of a risk you are of experiencing things. Okay, so to begin with, I'm just going to check your respiratory rate for 60 seconds. Okay, so just breathe normally, okay, and the time will start now. Okay, well done. So I'm just going to pop your results on here. So you had 17. So you actually scored a 0. Okay, so your respiratory rate is the amount of times that you take a deep breath in and out. Okay, and it's counted for 1 minute. So you had 17. So we would be concerned if it's anything sort of less than 10 and anything over 20. Okay? So between 10 and 20 you're sort of okay. Alright? So next up, I'm just going to check your oxygen saturation levels. Now this is to check the oxygen, and we use a little device like this, and it should typically be between, for a healthy person without any sort of comorbidities, without any oxygen problems, for example COPD or any airway respiratory problems, should be between 96% and 100%. You can't exceed 100%, but you can be between 96 and 100. That would be a regular healthy person as such. So I'm going to pop this on your finger. I'm going to turn it on, okay? It will make a beeping sound. Just hold your finger out like this. Okay, and then just pop your finger in for me. Good. Takes a few seconds to fully register. Okay, we'll just have a little look. So this one is saying that your saturation levels are 95%. So you're just under the cusp. Now this also has your pulse rate on it, so we can see that. And it's currently between 74 and 83. It is fluctuating, but that's probably because I'm talking to you. And just take a nice deep breath in. I want to try and just reach 96 for your saturation. So a deep breath in and out, and in and out. We reached 96, but it's dropped back to 95, so that's fine, that's okay. You are sort of on par. Alright, we're just going to take that one off. Okay, I'm going to pop that one aside. Now, although we had your heart rate on there, I am going to manually check it. Okay, so your oxygen levels were 96 and also 95 at times. So 96 would score a 0. However, I'm going to put it as 1 just because it was mainly 95 and we couldn't get up unless you took those nice deep breaths. So your heart rate did range between 74 and 83. So I do just want to manually check your heart rate. So what I'd like you to do is pop your arm out, and I'm just going to have a little feel. Okay. So pop your arm out, and I'm just going to feel here. Okay, just on the side where your thumb is. That's it. Okay, got it. 2, 3, 5, 8, Okay, it was actually 70 exactly, so that's very good. I will just pop down that it was actually 70 and you score a 0. So I like to do it manually because although the devices are really good at picking it up, at some point when you feel it manually on somebody, you can actually feel the rhythm, whether at that time if it is fast for a short few seconds or slow for a few seconds. But if you do it for a minute, overall it will be the accurate beats per minute. However, it's also good because if it slows down for a few seconds, you can actually feel it when you feel the pulse. Now, the things with the device is how it jumps from, say, 70 to 80 so quickly. Unless you have an arrhythmia, it's kind of just picking up the beat sort of for that few seconds, and then it averages it out. Yes. So a normal sort of heart rate would be between probably 60 to 90. Anything below 60, you have a slow heart rate, and we call that bradycardia. And anything over sort of 90, hundreds, that's tachycardia, and that's quite fast. That is very fast. We would be concerned. But at the moment, that's okay. So next up, I'm just going to check your temperature. Now for this one, it's very quick. I have it just in my medical bag. Here it is. And this one just goes, it can either go under your tongue or under your arm. Where would you prefer? Under your tongue. Okay. So I'm looking for anything above 36.1 till about 37.4. 37.4 might indicate you have an infection of some kind or you're unwell. Under 36.1, your body is cold. Okay. So I just want to check to see if you have a fever. So I'm just going to pop this on. Okay, and if you just open your mouth and just lift your tongue up. Okay, I'm just going to hold that. 1, 2, 3, 4, 5. Okay, there we go. Let's have a little look. So it's actually 36.4, so your temperature is absolutely fine. So let's just pop that on here. 36.4, and you scored a 0. Perfect. Okay, we're just going to check your blood pressure. Okay, so I do have a automatic blood pressure machine here. Now, have you had one of these done before? Good. Okay, so quite simple. This one's really quickly. It's I just plug it in, pop this on your arm, and it will work it out. Now, the normal blood pressure would be 120 systolic over 80 diastolic. Now, based on your sort of fitness levels and how you have been so far, I'd probably suggest that yours might be between 110 to 130, and then maybe 60 to 80 diastolic, okay? So, what I'm going to do, you just need to pop your arm out like this, and I'll use this side, okay? So I'm just going to connect it. Okay. And now what I'm going to do, I'm just going to open this. And we're just going to pop that on your arm. So if you can just pop that on for me. That's it. I need to just pop the sort of the wire where your artery would be. That's it, just so it's near your pulse. So we also get heart rate on here as well, so we can see if it all matches. Alright, is that secure and firm? Okay, so what I'm going to do, I'm just going to press the button. Okay, so I just press start and it will go. Just stay where you are, keep your arm nice and still, and just relax. Go. Should be going up now. It will be a bit tight, but don't worry, it won't last for long. Is it tight? Okay. So if you just wait a few seconds, even though it's quite tight on your arm, it will slowly start to go down. Okay? So it's just counting down for me now. Perfect. Okay, so your blood pressure is actually in the normal range at the moment. It's 116/89, and your pulse is saying 76. So your pulse has been aligned for, it's been fine for the saturation one, it's fine on this one, and when I checked it manually, it's all fine. So this is your current score. Okay, so let's just take that one off your arm. How was that for you? Not so bad? Okay. Alright, I'm just going to unplug this. And put it back in the bag. And we're pretty much nearly done. Okay, so I just want to check your pupil response next, alright? But that is everything on this form. So your blood pressure was 116/89, and your heart rate was 7. Perfect. So in terms of the news score, you only scored a 1, which was for your oxygen saturation level, so you're absolutely fine, there's nothing wrong. You're okay at the moment. Alright, so that's all done. But what I'm just going to do, I just want to have a quick look at your pupil response. Okay, so just have a little look at my nose and keep staring at my nose. Okay. Okay, that's good. That's good. And that one's good as well. Okay. Yep, that's fine. That one's fine. Okay, that's all good. And finally, I just want to check your breathing. Okay, so I'm just going to pop these in. Alright, and this one's just going to go on your chest. Okay, so just lift your top. Perfect. Okay, take a nice deep breath in and out. Good, take a nice deep breath in and out. Great. Okay, so everything sounds absolutely fine. Your pupil response was good, your eyes are corresponding perfectly, and your observations were fine. I honestly have no concerns. You're doing really, really well. Okay? Well, that is all for today. You're very much welcome. I hope that's given you a bit of reassurance. Perfect. Oh, hello there. You've got an emergency eye appointment. Okay, so I will be doing that for you today. And I just need you to confirm your full name for me. Alright? Thank you. Okay, and what's your date of birth? Perfect. And you are a walking referred from the GP. Okay, and just confirm your address for me. Yeah. Perfect. And what's your telephone number? Yeah. Thank you. Okay, so I've got you down here for an emergency eye appointment. I believe you went to your GP and they referred you straight to us. Perfect. I'm glad that's all making sense. Okay, so I just need to fill out this emergency triage form. Okay, we'll have a little look, check your eyes, and just see what's going on. Alright? Perfect. Okay, who's your usual eye doctor? Okay, yep, I know the one. And when was the date of your last eye checkup? Roughly? Okay, quite recently then. Alright. And we've got your referral. Okay. So, okay, so what symptoms have you been experiencing? Dizziness? Okay. And is this what you went for the GP for? Okay, that makes sense. You might have a sensitive to light, yes. Okay, I'll put query light sensitivity. Okay, and have you been experiencing this for a long time regarding your sort of headaches, dizziness? Okay. It's very important to get it checked. It can cause that. It can be a leading cause of your headaches, especially if you need glasses or anything at all. Okay, so have you got any issues regarding sort of your right eye, your left eye, both, or do you just want a general check? Have you been experiencing anything in sort of either eye? Okay, so we'll check both eyes today. Okay, are your eyes painful? Not really? Okay. And how's your vision, roughly? So, would you say it's been the same as it always has been, or have you noticed yourself straining a lot more? Okay. Do you have any redness? No, you don't have any redness. Do you know if you are sensitive to light? Do you know that at all? So if you stare at light for a long time, or do you spend a lot of time in front of a screen, a computer? Okay, what do you do for work? Right, okay. I'm going to put yes to light sensitivity, because we can give you some sort of blue light glasses. Yeah, that will help with that. That's fine, so that's what we're going to fill out when we do the test. Do you have any itching in your eyes? Okay. You've not got any stickiness, no pus or anything. And are they watering? No. And any swelling? Nope, no swelling. Okay. Do you have any double vision, do you know? Okay, blurred vision. Any distorted or anything? No, okay. Okay, let's have a quick look over at your eyes. I think you may just need some glasses, or you need some of our blue light glasses. Okay, based on what you've told me, if you're not having sort of any issues reading or working in terms of visually seeing things, usually it is just maybe down to light sensitivity, and that may be a trigger for your headaches as well. Okay, so I'm just going to put some of these gloves on. Alright, first of all, I'm just going to have a little feel around. Okay, just let me know if you're in any pain or discomfort. Okay, they feel fine. What I'm going to do, I'm just going to have a little look into your eyes with these lights. So just look over here for me. Good, keep looking over that way. Thank you. That's fine. Now look over this side. Look at my nose. Very good. Look at my nose. Good. Okay. Look at my nose again. Look at my nose. Very good. Okay. Just want to try this light. It's nice bright. That's fine. Alright, could you just follow the light for me? Just follow the light. Very good, follow the light. And how does that feel? Any pain, discomfort? Were you struggling at any times? How do your eyes feel now? You don't see any sort of black spots? Okay. Alright, just look here for me. Look here. Look here. Look here. Look here. Good. Look here. Look here. Look here. Look here. Look here. Okay. Alright, how many fingers do you see? Good. How many fingers? 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 Very good, okay. I'm just checking your blood vision. Alright, look at my nose. Tell me which side, left or right, moves. Okay? Which side? Good. 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 Which side? Very good. Which side? Excellent. Well done. Alright. Just quickly, I want to just measure your eyes just to make sure they're all in proportion. Alright, what I would like you to do, just tell me what colour you see. What colour is this one? Good. What colour is this one? Good. What colour is this one? Very good. What colour is this one? Perfect. What colour is this one? Good. What colour is this one? Excellent. Alright. Now, could you just follow the orange pen? Okay. Follow the orange pen. Good. Follow the pink pen. Good. Follow the pink pen. Perfect. Alright, well done. And finally, could you just read this eye chart for me? Okay. Good. 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 Struggling a little bit? Okay. What colour is this one? Good. And what colour is this one? Perfect. Okay. Can you see the numbers down here? Can you tell me what number this one is? Good. Can you tell me what number this one is? Okay. How about this one? Alright. Okay. Let me get my light again. Alright, can you just look at the light? Look directly at the light. Good. Look directly at the light. Look 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 at the light. Good. Look at the light. Okay, follow the light for me, please? Does it start to feel bright? Okay. You're starting to get your headaches. Alright, that's fine. I think it's related to your light sensitivity. Alright, so what I suggest, your vision is generally okay. I'm not concerned about your vision at all. I'm more concerned about your sensitivity to light and looking at light for long periods of time. So what I suggest is getting some glasses, primarily just for light sensitivity, and when you're working or when you're on your computer, when you're on your phone devices, or even when you're driving, glaring with the lights is going to be a problem. So I'm going to just show you some glasses. Let me know if you like any, and I will put a blue light on them, and then you can collect them when they're ready. Alright? Good, okay. So I have a few pairs that I can show you. Alright, this is the first pair. They are sort of part of our big glasses collection. What do you think? Do you want to try them on? Okay. There you go. How's that? Okay. I don't think these ones suit you. Let's try some others. We also have brand new, these ones in black. They're exactly the same style, except they're black, okay? These ones are blue light glasses, as you can see. Okay, ready? How's those? You don't like the thickness of the... Okay. You like my glasses? Okay, how about these ones? They are slightly different. They're clear frames. The thickness is the same as the others. They're very similar to mine. Again, these have got the blue light in them. You want to try them? Oh, I think those are the ones. These ones are a little bit dirty because they are the display glasses. However, what I'll do, I'll get your measurements and I'll put an order in for these ones. How does that sound? Perfect. Yes, these ones fit you a lot better. Did you want to try them again? Okay. Do you already see a difference? Yes, it just puts a little tinge. Okay. Alright, so what I will do, I just need to take some measurements. Okay. So just sit nice and still for me. I just need to measure you the bridge in your nose. Okay, so that is... And then I'm just going to measure this part to your ear. Okay. Alright. Okay, perfect. Okay, so are you happy with the outcome today? We're going to get you some glasses prescribed. They're going to have the blue light anti-reflection in them for when you're working. and I suggest wearing them at all times, even when you're reading. You don't have to wear them sort of when you're going out and about if you don't think you need them, but if you're going anywhere with any particular bright lights or anything, I highly suggest wearing them, and I think it'll reduce your headaches and migraines, and hopefully you don't feel the lightheaded dizziness you've been getting. Alright, it's definitely worth trying. Yes. Okay, well, thank you so much for coming in. I'll get these sent off to you and we'll be in touch. We'll give you a call when they're ready for collection. Alright? Perfect. Okay. Well, thank you so much for coming in at such short notice, but I'm glad we were able to do this for you. Alright. Well, take care. Oh, hello there. I'm sorry. I was just doing some studying. How are you? Okay. Yeah, no, that's fine. You are right on time, actually. Okay. So, just confirm your name for me, your full name. Perfect. Thank you so much. And your date of birth. Great, that's excellent. Alright. Well, my name's Bryony. I'm a medical student. So I'll be carrying out your cardiology appointment today. Alright? So just to begin with, I need to just ask you some questions just based on your current health history. Okay? So, have you ever been diagnosed with any heart problems or heart disease? Okay. And have you ever been hospitalised because of that? Okay. And have you ever experienced any of the following? Pain or discomfort in the chest, in the arms, throat, jaw, or your upper back? Okay. Do you ever get shortness of breath? Okay. And do you struggle normally to sort of mobilise, get up the stairs without getting shortness of breath? Okay. That's fine. Do you suffer from high blood pressure? Okay, you're not sure. That's fine, we'll check your blood pressure today anyway. Okay, do you currently have a fever? Okay, do you ever get palpitations? Skipped beats? Okay, do you know if you have an abnormal heart rhythm? Okay, do you ever get blackouts or fainting spells? Okay, any dizziness, lightheadedness? Okay, do you ever get cramps in your legs, primarily when you're walking or laying down at night? Okay, Do you have history of blood clots? Okay. Have you ever had an abnormal ECG? Okay. Alright. And have you ever had any of the following cardiac tests done? Have you ever had an exercise stress test or a treadmill test? Okay, what about an echocardiogram? That's an ultrasound of your heart. Okay. Have you ever had a monitoring device? Okay. And what about an electrophysiologic study? Okay, you would know about it if you did. Okay, alright, everything's looking fine so far. Have you ever had surgery? Okay. That's fine, and you don't have a pacemaker? Okay. Have you ever been shocked? Okay. It's always good to know. Okay. Alright, and are you on any current medications? Okay. You want any blood thinners? Okay. And do you have any allergies to any medications? Okay. No, that's absolutely fine. No. Have you ever had any injuries or broken bones? Okay. Alright, that's fine. Nope, that's all good. Almost done. Have you ever had a blood transfusion? Okay. That's fine. And do you have any of the following? Diabetes? Have you ever had a stroke? Okay. What about kidney disease? Or a severe illness? Okay. That's fine. Okay. Do you currently smoke? Okay. Do you drink alcohol? Okay. How many units per week? Okay. Do you wear any lenses, contact lenses? Okay. Do you have glaucoma? Do you have cataracts? Okay. Do you have any visual impairments? Okay. Do you have any hearing impairments? Okay. Any hearing aids? Okay. Do you have any sinuses problems? No. Do you wear dentures? Okay. So we just have to ask. Okay. Do you have any headaches? Recurring headaches? No. About migraines? Okay. Have you ever had pneumonia? How about, do you have asthma? Okay. Have you ever had tuberculosis? Okay. Have you ever had a chronic cough? Okay. And have you ever coughed up blood? Okay. Okay, that's fine. Alright, that is pretty much everything that I needed to go through. It's just so I know your medical history and just a little bit about you. Can you just tell me what it is you've been experiencing, just so I'm aware? Shortness of breath. Okay. Okay. Any headaches or anything? Okay. Alright. Well, I think you're okay, but we'll check anyway. So what I'm going to do, just go to check your breathing. Okay. So what I would like you to do is just breathe normally for me. Okay. Take a nice deep breath in. Alright, good. Okay. Take a nice deep breath in. And out. Good. Take a nice deep breath in. And out. Very good. Take nice deep breath in and out. Excellent. Okay, I'm just going to have a little listen. Okay, just breathe normally. Okay, now take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Excellent. Take a nice deep breath in. And out. Good. Take a nice deep breath in. And out. Okay, I'm just going to do your back. Okay, take a nice deep breath in. And out. Okay, take a nice deep breath in. And out. Okay, one more. Take a nice deep breath in. And out. Okay, good. Alright, that sounds fine. Your lungs also sound okay. You don't sound chesty or anything at all. Everything sounds okay. Alright, so what I'm going to do, I'm just going to check your pulse. So just pass me your arm. Okay, just have a little feel. I'm just going to count your heart rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, 121, Okay, that's fine. So your heart rate is 83. Alright, so that's all good. Okay, so 83 heart rate and your breathing is fine. Okay, what I'm going to do now, I'm just going to check your oxygen saturation levels. Okay, I just want to make sure that your oxygen levels are fine, especially if you're feeling a little bit out of breath here and there. Okay, so what I would like you to do is just put your finger in here for me. That's it. Okay, good. So it should be above 96. Good, so yours is 98%, that's excellent, and your pulse is saying 74, so that's also good. Okay, but this just checks your pulse automatically. Manually is more reliable. Okay, so that's great, thank you. And next up, I'm just going to check your blood pressure. I just want to see if you're hypertensive or anything. Okay, so have you had your blood pressure checked before? Numerous times. Okay, so let's just open this up. Okay, so you're going to pop this one on your arm. That's it, it needs to be that way round. The tubing needs to be along the same side as your main artery. Okay, so that's it, put that there. Okay then, alright, so we're just going to turn it on. Just relax your arm down by your side and just relax. It should start to inflate now. There we go. Okay, and in a few moments it will start to deflate. Okay, so just bear with. So a normal blood pressure is 120/80, but there's some leeway either side, probably about 10 either side, it's fine. Okay, so your blood pressure is actually 102/70. 75, and your pulse is 73. What I want to do, I just want to switch arms for your blood pressure. Okay, so I'm just going to try it again on the other side. So just pop your arm in there for me. Perfect. Let's twist that round ever so slightly. That's it. Okay, and just relax your arm down for me. We're just going to repeat that, okay? Do you feel dizzy at all? Okay. Yeah, your blood pressure is just borderline sort of low, but it's okay. Sometimes it happens. And have you had something to drink and eat today already? Yeah, maybe you need a little bit more water. Has it gone much tighter this time? It has? Okay. That's alright. Okay. It should just start deflating now. Oh, that's much better. So your blood pressure is 121 over 89. Okay, and your pulse is 71. Alright, so you have absolutely nothing to worry about. Sometimes it's better on one arm than the other. Yes. Okay. So what I'm going to get you to do now, I'm going to get you just to do a little bit of exercise, okay, just for about 15 seconds, and I just want to check your heart rate after that. Okay, just want to do a little test. So just sit where you are, and you can either decide to do some squats or just move side to side like this, but you need to sort of do it at a pace where you can go quite quickly. Okay? Alright, ready? You choose. I will count to 15. Okay, so either do some squats or move your body from side to side like this. Alright? Ready? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. Take a seat. Alright, get your breath back. Okay? And just try and relax, okay? I just want to see how long it takes you to recover from doing some exercise. So I'm just going to have a little listen on your chest. Just going to pop that one there. Okay. Okay. Okay, and take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Very good. Take a nice deep breath in. And out. Take a nice deep breath in. And out. Excellent. Okay. Well, that all sounds fine. It sounds a little bit faster, but that's expected as you've just done some exercise. Okay. I'm just going to check your pulse again. So just pass me your wrist. Perfect. Okay. 1, 2, 3, 4. Yeah, that's okay. I'm just checking half because I just need to see if it elevated, and it's just a sort of moderate, so that's fine. So what I would like you to do is just take some nice deep breath in for me. Okay. Well, this is the end of your examination, okay? I don't think there's any concerns immediately, but what I will do, I'm going to refer you to have an ECG done just to make sure. Okay, so we cannot do that today, but I will send off a referral for you to get that done. But everything else seems okay. Your blood pressure's fine, your oxygen levels are fine. You have recovered well since doing a short exercise, which is great. but I would like to see an ECG. Okay, so we'll get that referred for. So you'll get that in the post, and then you just go and have that done. Alright? No problem. Take a deep breath in and out. Good. Take a nice deep breath in and out. Very good. Alright, well, you're free to go now. Thank you so much for letting me do your examination today. Yes. Alright, well, take care, and I'll see you very soon. Bye-bye.